for New Westminster Burnaby.
Mr. Speaker, a year ago, Liberals promised an immediate commitment for home care, but 363 days later, Canadians have seen absolutely nothing, not a cent. The government seems to be using this old commitment to distract from the fact that they're adopting Stephen Harper's cuts to the health care escalator. Right. Now, promises aren't negotiating chips, Mr. Speaker. They're promises. Why has this government abandoned true negotiations with the provinces? And why has the Prime Minister adopted the Stephen Harper approach to health care?
The Honourable Prime Minister.
Actually, the Stephen Harper approach to health care consisted of writing a check and then not checking to see whether it was actually spent on health care. Canadians expect that new money invested by the federal government into health care be actually spent on health care. On top of that, we've made commitments to work with the provinces to invest in home care, because Canadians know that what we need is a system that cares for the sick and cares for the elderly, and demonstrate the kinds of collaboration within provinces and with the federal government that didn't happen for far too long.
Member for New Westminster Burnaby, order.
So how do we take care of the sick and elderly when Liberals are cutting $5 billion a year from the health care escalator by 2020, just like Stephen Harper? Same old, Mr. Speaker. Now, the Prime Minister won't even sit down with the premiers. He's adopting Stephen Harper's rather insulting approach to the provinces. So much for real change. The premiers have made a good-faith proposal to give time to get Canadians out of this immediate health care crisis. We need a simple answer. Will the Prime Minister delay the Harper cuts for a year? Yes or no?
Honourable Prime Minister.
Actually, Mr. Speaker, we're looking forward to investing $21.5 billion in health care over the next 5 years of new money, and the only expectation we have is the expectation the Canadians have, that that money be actually spent on health care. That's what the previous government missed out on when it was investing in health care. We know that health care money must flow to health care. That's what Canadians expect. That's what the provinces expect as well.